I'm Lydia Kenkros. I'm a doctor in a public sector hospital, and I have an interest in how we manage this pandemic in a just and equitable way.
We have a public-private health system where the majority of the money is spent on the minority of people. And so people with medical insurances and medical aids in South Africa have sometimes the world's best care, whereas our public sector patients get sometimes the worst care. And so we have to find a better way of managing our health system.
We know that most intensive care beds are in the private sector. We also know that the government has come to an agreement with the private sector about pricing for private healthcare. But what we have not seen is an agreement about a uniform set of guidelines between the two sectors. The guidelines that we use in the public sector for many illnesses are partly driven by best clinical practice, but also driven by resource scarcity. In other words, we can't always do the best that we would like to do because the resources are limited.
Now you've got doctors who might be having a public sector patient and a private sector patient. This one's funded, this one isn't. And if you go and do your full protocol on the public sector patient, you won't get paid for it. Because the public sector has got to deal with you. We're going to pay you only so much. There's a huge problem of equity.
The need for this agreement on a standard set of guidelines is particularly urgent right now, as in the Western Cape we are seeing the ICU beds both in private and in public filling up. We cannot have a situation where the ongoing inequality in healthcare, which we've seen for decades, continues during the COVID-19 pandemic.
What's going to happen when people go to a private hospital thinking that their government has made a plan for them, and the private hospitals are closed or the private hospitals turn them away? What's going to happen? How do we explain to our citizens that we didn't get round to having a scheme that supports them wherever they are? We didn't get round to funding a system where every citizen in this country has the right to the best care that they can be given, irrespective of whether they have a medical aid or not, and irrespective of whether they're in the public or private hospitals in our country.
We have over 15,000 private practicing doctors in our country who have been willing to step up to the national response in the interests of the country, because they are doctors trained in South Africa within the same ethical envelope as their colleagues in the public service. You want them all on board. You want them all operating in a seamless way with their public sector counterparts in mitigating the crisis.
What we're calling for is empowerment of the clinicians who are on the ground, who are doing this work. They should be the ones who are coming together, not as doctors and nurses under private or public, but as one set of health workers that are coming together and making the best possible guideline for all of our people. We would like the Department of Health to facilitate that, and we would like that to be a transparent and open process that takes into account the best medical evidence and also the resources that we have. Knowing that the medical evidence is changing all the time, at the same time we know that our guidelines need to shift. But how that is done and how that is benchmarked against best outcomes versus resources needs to be clear and open for everybody.